Welcome to the Canadian Dietitian School. I am your fairy instructor, Tesh Varagas. I create content for dietetic interns, new dietitians, and dietitians looking to learn new skills. We are talking about starting a new tube feed and the steps that I take to start a new enteral nutrition plan for a patient. The steps that I follow are: number 1, complete a nutrition assessment. Number 2, consider refeeding risk. And number 3, calculate and write orders. I'll be making a few videos to go through these steps, so today we will focus on the nutrition assessment. I will talk specifically about the assessment components that I especially consider for tube feeds. The first part of the nutrition assessment is reviewing the patient's medical history. What conditions do they have? How do those conditions impact nutrition requirements, like calories and protein? How might they impact the formula selection or the fluid provision? There are many conditions to consider, but some important and common ones are diabetes, heart failure, and kidney disease. Next, consider the indication for tube feeds. Why does this patient need tube feeds? Can their nutrition needs be met orally, and is it safe to tube feed, or do they need parenteral nutrition? Take a look at the patient's weight, height, and BMI. Consider the patient's weight history. Have they lost or gained recently? How much? Do you want to base your tube feed order on an actual weight or an ideal body weight? It is important to review the patient's blood work, especially their electrolytes like sodium, potassium, magnesium, and phosphate. These can help inform you of fluid status and risk of a refeeding syndrome. Next, consider if the patient is having their blood glucose tested. Are they within a normal range? Are they consistent or stable? The tube placement is another consideration. What type of tube does the patient have? Nasogastric feeding tubes are often confirmed by chest x-ray for placement in the stomach before nursing staff begin the feeds. Feeding into the jejunum is an option when gastric feeds are not tolerated or in certain clinical scenarios such as severe pancreatitis, SMA syndrome, or for a patient with a very high risk of aspiration. Next, consider the patient's bowel function. A change in bowel movement, such as a sudden onset of diarrhea, can be a sign of intolerance, but it's not likely a sign of tube feed intolerance if the patient is having diarrhea prior to starting the tube feed. Severe constipation prior to starting the tube feed may increase the chances that the patient will not tolerate the feed. After all, if things aren't moving, the tube feed formula has nowhere to go. Next, I would consider what medication the patient is taking. What is the frequency of medication? Will the patient be taking their medications through the tube, or are they still able to take medications orally? If they are taking medications through the tube, we would need to consider the volume of water needed for this and how often they are given. There are also some types of medications that are recommended to be taken separately from food or tube feed formula. This can include levothyroxine, fluoroquinolone antibiotics, and more. Another part of your assessment will include a review of any IV fluids that are running. How much fluid is the patient getting? What are the components of the IV fluid? Does it contain dextrose? How many calories? Consider how much sodium and potassium are provided by IV fluids. Lastly, consider the patient's oral intake. How much are they eating and drinking? Determine an estimate for calorie and protein being regularly consumed. If they are eating very little or perhaps not able to eat at all, how long has that occurred? This is important for determining the risk of refeeding syndrome. Determining risk of refeeding syndrome is the next step that we'll be talking about more in a future video, so stay tuned. Thanks for joining to learn about nutrition assessment for enteral nutrition. Please like and subscribe, and I'll see you next time.